Whether people have a disability or not, digital mediums might not be accessible for all. Inclusivity for everyone means that information must also be made available via posters, print, radio, and SMS messages. There can be many reasons for this. Persons with disabilities may be at an increased risk of contracting and experiencing complications from COVID-19 because of the underlying health conditions and stigma within the society. Information is often not accessible, and too often people with disabilities are out of the public eye, especially when they are in residential healthcare settings and care homes. The close interactions with support staff that some persons with disabilities require often increases their exposure to COVID-19. Too often, discriminatory attitudes towards disability continue to be prevalent. As we continue to navigate this global pandemic, what can we do to ensure that persons with disabilities have equal access to healthcare systems and make sure that all critical information is fully accessible? No matter how complex the wider societies they live in, whether it's in towns or cities, it's vital that persons with disabilities are quickly identified and located. Many European countries are already undergoing reforms to close down institutions for persons with disabilities in the near future. Persons with disabilities should be living independently at home in inclusive communities. Speeding up this process in times of the pandemic will help protect persons with disabilities against their higher risk of contracting the virus. Such institutions must be especially vigilant in adhering to measures that contain the virus. Women with disabilities are among those facing multiple discrimination and are therefore at even greater risk. Disabled persons' organizations are often the best point of call when it comes to helping identify those most marginalized. Those organizations do an important job and must be supported. And there are other inclusive solutions that need to be implemented immediately. Where possible, locate persons with disabilities by ensuring tracing apps and mainstream databases for emergency support are inclusive and accessible. Tracing apps should be accessible for all, including persons with visual impairments. To make critical information accessible to everyone, messages must be produced in multiple formats and all local languages. Emergency hotlines must function equally well for everyone, for example, persons who are deaf or have a hearing impairment. Ensure that essential items can be delivered to those who need them, both in towns and in cities, and also to those in remote areas. The COVID-19 pandemic remains a challenge, and persons with disabilities are amongst those at greater risk. This will remain so until all emergency health services are fully accessible and disabled persons' organizations are involved in the planning and preparedness measures. A disability-inclusive response is always more effective and efficient for everyone.